Hey folks, Dr. Josh Luke here with the Health Wealth podcast and radio show. Thanks for tuning in once again. It's my honor today to have a guest all the way from Texas, Jeff Bernhard, who is the president of Continental Benefits, a full-service TPA. For those of you who don't know what a TPA is, a third-party administrator. And as you know, on the Health Wealth podcast and radio show, our goal is to talk about healthcare affordability in America. And while a good percentage of our listeners are HR directors and finance advisors for their businesses who are responsible for reducing that spend, a lot of our message is all about, hey, unless your employees engage in the process and become engaged healthcare consumers, it really doesn't matter how much you do for them because your costs will never come down. So even though a majority of our listeners are involved some way in their business, we also talk a lot to that individual, the father, the mother, the single person, whoever it might be, about engaging in the process. So today, I want to talk, first of all, with Jeff. I want to actually go right to the end, which is he just launched this really cool, I don't know if it's a podcast or show or a YouTube channel or what it is, but I kind of want to skip right to the last question because it's so cool and it's the greatest name you'll ever hear. And if you listen to the Health Wealth podcast and radio show, if you're part of the Health Wealth Nation, you already know his partner in crime, and that's David Contorno, who's been on the show before. David and Jeff launched a series called Friends with Benefits. So, Jeff, why don't you introduce yourself and tell us why Friends with Benefits is a passion of yours?
Yeah, thanks, Dr. Luke. So, number one, David and I have been together for a long time, and I've been in this industry way too long. But like David, he reminds me of a younger one of me with more energy. And what we're trying to do basically is like everybody, trying to offer real-time positive solutions to healthcare. So to get attention, as you know, these days you got to come up with a catchy name. So Friends with Benefits seemed like the appropriate thing. And it's funny, I had one of our employees the other day come up to me. She's probably in her late 20s, and she said, "Jeff, do you know what that means, Friends with Benefits?" I said, "Come on, how old do you think I am? I know exactly what it means." But I think what the real connotation is that we're trying to reach across all different types of relationships with doctors, hospital administrators, carriers, TPAs, PBMs, employers, actuaries, and try to figure out how do we work through solutions together. We've got to solve this, folks, and as you know, David's a consultant. I'm a president of a TPA. We got to figure out how to do this together. So we don't have any room in our series for negative energy. So what we're going to do is we're going to talk about real type solutions. Then we're going to get the next step of the series, which is called Friends with Benefits Long Distance, which is very similar to what you're doing here. We're going to get David and I, and it's like the hot seat with ESPN. They used to ask you 10 minutes of questions. We want to get people on, like hospital CEOs and PBMs, and talk about what they're doing in their part to fix healthcare. So it'll be a very pointed, very direct show, but like you're doing here, we're trying to get the word out and be positive about it.
And for those, Jeff, who aren't from the kind of the insurer, carrier, broker, TPA side, I'm going to ask you really quickly to kind of give the 60-second 101 version of what a TPA is.
Sure. So that stands for third-party administrator. So what we basically do is we do just about everything that a carrier, like a Blue Cross, Aetna, Cigna, United, would do. The only difference is that we don't take risk. Okay, so we do not offer what we call fully insured plans. All of our customers are self-funded plans. So we do everything from customer service, compliance, plan design, pay claims, population health, utilization management, case management, everything, work with PBMs, everything that's involved, except that we do it quicker, faster, better, stronger. So we don't have 100 years of infrastructure. So I guess it's the best way of saying is that there's a way to get from point A to Z, which is yellow cab. There's also something called Uber, which is a different, more pleasant experience. So that's what we're trying to do now. We do partner with carriers to the extent of one thing. We do lease their network. So we do work with our valued partner Aetna, and we lease their valuable, strong PPO network. We're very proud of that. We do lease a network from Cigna as well. And as you know, there's only 4 left. So it's Cigna, Aetna, United, Blue. So we have 2 of the 4, but pretty much, as you know, all those PPO networks are in a pack, and they pretty much have 99% of the same providers. The difference is, and we'll talk about in your show next, what do we do with that network that makes us different?
So TPAs, in essence, when self-insurance became kind of the trend and then the norm, the TPA, was hired to protect the interest of the company who says, hey, I'm not an expert in insurance, but I know that if I hire an expert who's got my interest at heart, that we can save money. And in principle, that's the right approach. Now that we really go to the next step, which is getting employees to engage, which is really the only way you're ultimately going to drive the company's costs down. But before we get to that conversation, Jeff, so to share with the Health Wealth Nation, here's what's interesting. So when Forbes asked me to write this book about healthcare affordability, which was probably in April or May of 2017, I woke up the next morning and said, gosh, why did they pick me over some of these other guys that Jeff and that I'm now friends with, that Jeff's known for years, who have done this for a living? And the further I get down this trail, because I'm not an expert in healthcare affordability, I was a hospital CEO who was just telling the truth and being transparent and pulling back the curtain on the healthcare hospital system industry, which nobody else was doing, which is why I appealed to them. They wanted an industry insider, but I woke up the next morning and said, hey, but I'm not an expert in this, so I had to go research it. I met a lot of folks, a lot of guys that have been on this show, like Jeff Bernhard, David Contarno, Dave Chase, all these other guys, Brian Clapper, all these folks we've talked to. And there's a group, a listserv or a chat room, if you will, with about 60 people. And what's really dawned upon me in the last 90 days since the first of the year in 2018, when I was asked to join this group, is almost everybody else there is from the carrier broker TPA side, which the more I get into it, the more I realize that's the problem. Is the people carrying the message are the same people that the general public says, well, how do I know I can trust them? And so what we see now is folks like Jeff and myself taking the podcast, taking the Friends with Benefits to the people saying, hey, we're not a broker. We're just here to say we can help. We know there are brokers out there doing the right thing. So tell me a little bit, Jeff, being kind of in this space a lot longer than I have, how big is that credibility issue? Because the stories you and I see every day are outrageous, and they would outrage the general public. Why isn't the general public outraged quite yet? Is it because of the broker credibility issue?
Yeah, I think it's a mix of a number of things. This is a typical status quo situation, and the people that hold the status quo now are holding on with dear life. And there's money involved. I won't get into the details of how the money's involved, but anytime things aren't moving, you have to follow the money trail, and that's for a different episode. But at the end of the day, look, here's what we do. We are an independent TPA. This is not a plug on my company, Continental Benefits. It's simply that when David and I and others go out, I speak publicly, probably like you, around the nation, to a lot of healthcare leaders. I'm not there to pitch my company. I'm there to inform. I've had the pleasure of working with some of the brightest minds in the industry, some of the largest employers in America for 25 plus years. Nobody has all the answers, but I've been fortunate to work with these folks and share what I know. What we basically think we know around healthcare right now, you're right, we don't know. And there's a few people that understand the provider side, the drug side, the contracting side, the insurance side, the actuarial science side. I'm fortunate that I'm one of them, but that doesn't make me great. It just makes me responsible for sharing the message and sharing it in an unadulterated way, not to sell people, but to inform them. If I can come across as the expert, quite frankly, I don't care that you buy it from me or not. Buy from somebody else that does something similar to what I do, because if we do not change the trajectory and course that we're on, we are heading to a brick wall. And so one of the things I want to go back to and I want to talk to you about is that if we don't change the behavior of consumers, you're right. But if we don't change the buying behavior of HR managers, CFOs, and benefit managers, and if they don't consider taking their fiduciary responsibility more serious, we've got more issues. So what do I mean by that? I have companies that I come across that have had, and there's nothing against Blue Cross, this is an example, Blue Cross and Blue Shield for 15 years and have not bid it, haven't checked the market. What do you think? What do you know that's the same in any industry, let alone healthcare, for 15 years? Okay? Everything changes. In the past year, things have changed. So I think what we really have to do is we have to get CFOs and HR and benefit managers not to be afraid, and not to be afraid that moving away from status quo is a bad thing. And there's a lot of good options there. And what we just have to get people to pick up their heads. And there's a good reason why a lot of brokers and consultants aren't bringing you more than the traditional option, what we call BUCA, Blue, United, Cigna, Aetna. It's because either, I guess I don't think this is the case, but either they're lazy, either that they haven't taken the time to find out about it, or perhaps there's some other financial incentive that's keeping it in place. But the fact of the matter is I could list 5 what we call super TPAs, Continental one of them, which is changing the landscape completely. And I'd like to give you 2 examples at the appropriate time on the show to talk to you about how different that is.
Yeah, and it's been such a learning experience for me as somebody who now in 2000, I did one employer broker event in 2017, and the reaction was, wow, you got to keep doing this. So I booked 5 or 6 more. My message has gotten better, and being included in this group, this chat room of all these experts, I definitely am a fish out of water, and it's as I get to know folks like Jeff, where they say, hey, this guy's just helping us pull back the curtain. He doesn't claim to be an expert. In fact, I claim to not be an expert. I claim to be an expert who can open the door so I can introduce folks to Jeff and Dave and David Contorno and others to say, there are people doing it well, have been for years. It's one of the biggest farces in America that there aren't ways to reduce your spending for your company by 30%. And it does start, and that's what actually is fun for me about these new speaking gigs with HR and financial managers, is all they have to do is say, I'm going to declare the tipping point. And I just think my timing on this book and getting included in this club's perfect, because look, my book came out January 18th, the same day Intermountain and Ascension named they were firing their pharmacy and starting their own, right? Then within a week, Apple, we're going to partner with 12 Health Systems to give your patient record to you finally. A week later, Amazon, JP Morgan, Berkshire Hathaway, which we'll get to in a second. A week later, Disney in Orlando says no more insure. This week, we saw another announcement come out of Apple. And now Google is saying we've got our own insure. 2018, we're not even 65 days in. And there's been 5 or 6 of the top 8 companies in the world say we're done. We've reached our tipping point. So it's an exciting time. So Jeff, on that note, you and I both talk a lot about transparency, and it's so easy to point your finger at an insurer when you're a consumer, but really, are the insurers at fault? Absolutely, their profit margins are through the roof, but it starts with the hospital that is not transparent and raises their rates every year. We pay because we haven't engaged, and I call that becoming an EHC. I want everybody to become an engaged healthcare consumer, like you would when you buy a car, like you would when you buy a house. Engage in shopping. If you haven't seen David Contorno's video on his procedure, he went to Oklahoma to do, it's the perfect example of he just stopped and shopped. Stop and shop. He found a better deal, and when we start to do that, we force competition with hospitals. By the way, is that your dog or mine that's making that?
No, it's mine. I'm trying to figure out how to mute this thing. Sorry.
All right, no worries. So with that said, little dog humor there on the show. Tell us, Jeff, what you've seen nationally. 1 or 2 examples of companies, and it's not just their HR director saying we need a better rate or we're going to shop. It's thinking about things differently. Understanding there's alternatives to the status quo. Give us a few examples that you say, these guys get it, they made a massive change, and there's people out there to do it for them, is the point I want to make. All you got to do is hire somebody to turn the key for you, right? You just say, yes, we're willing to do it. Here's a check. Your ROI is less than 12 months sometimes. Tell us a couple examples.
Yeah, so I think, in the day and age of lack of transparency and things getting so complicated in healthcare, people like David Contorno and I and Dave Chase and other leaders that you mentioned want to get back to practicality. So let me give you 2 examples. And they're things that HR VPs understand. They're things that CFOs understand. So when we use the Aetna PPO network, under most carriers, they have something called medical bill review. So when hospitals, as you know, Josh, when they submit a claim to an insurance company, they submit something called the universal bill. And a universal bill is a summary of all the charges that occurred for someone in an inpatient stay, as an example. So under most carriers, they do not edit. They do not check bills below $25,000. It's something called auto adjudication. When it comes in, it goes out. What Continental Benefits has decided to do is instead of starting at a $25,000 threshold, we bring that threshold down to $5,000. And before we pay a bill, so we get a bill from XYZ Hospital for a hip replacement, or let's say it's a knee replacement. It's $12,000. And what we do is we say we will not pay that bill until you, hospital, give us an itemized bill. And we will have our experts that are medically trained look at it and look for errors and mistakes. Now, we hire out a different vendor to do that. It's one of the vendors that do just about all TPA contracts and carriers in the country. The difference is that we start at this low threshold, they start at a high threshold. So before we pay the hospital, we review the bill. Do you know what percent of that bill? So let me say it a different way. What percent over and above the unit cost that we pay is errors?
I don't want to guess, but I know it's a lot.
Yeah, so 90% of the hospital bills have errors. Okay, 90. Now, some of them are $2 and some of them are $25,000, but we check them and we add. So if you look at discounts, and I don't believe in network discounts, if you look at that and the discount is 55%, on the in-network piece alone, we add 6.5% over and above the 55. That's a lot of money. 6.5% to a medical spend, folks, 6.5%. So the other thing that we do is we pay close attention to out-of-network charges. So a lot of times people go into a hospital and they'll have a non-par or a non-participating out-of-network anesthesiologist, radiologist, pathologist, assistant surgeon, or ER doc step in, and they'll get hit with an out-of-network charge. We go after those and negotiate on behalf of the customer member over $1,000. So we go down to a lower threshold. That adds another 5%. So you add 6% to 5%. That's 11.5%. So if you have a $10 million spend, right? That's $1.1 million that we've added to your bottom line that we found in mistakes. Okay. Now we can't question the carrier network and say your bill charge is reasonable or not, because that's what's been agreed to, but we can check for errors. So we take our fiduciary responsibility to pay claims right very seriously. We get no medal or no prize for paying a claim quickly in 5 days. We do get commended for paying it right. And so that's one. And David Contorno, he can tell you, all his groups that we have with us, his one group they had a carrier before, typical carrier. They went negative 25% with us. Another one went negative 7, another one negative 13. So not only do you not have a trend going forward, but you have a trend going backward. So are we doing anything magical here? No, this is practical. Paying attention, using good process, good technology to do what you have to do. So that's really what's been popular for us these days. So we pay attention to claims. The second thing, which we just started, and I'll tell you a little bit about it because it's launching in 7/1. So Josh, if I said to you, you live in Southern Cal, right?
Yep.
All right. You're a little bit different because you're a doctor yourself. But if you decide to go out and play football and you tore up your hip and you had to get a hip replacement and you're the average member in a group, who are you going to go see? How do you know who the number one quality hip surgeon is based on CMS quality-based data, the largest payer in the land, in Southern California? How would you know?
You ask and you research.
Okay, but where exactly are you going to go?
Gosh, that's a good question. I mean, I think if you're in the know, you can go to the CMS website. Do you trust that it's up to date and accurate and true? No, but I think most people probably go to the hospital or call their carrier.
Yeah, so I will tell you, carrier's not going to tell you.
Yeah,
they're not going to tell you quality ratings.
I know. I just said that's where people
go. Having spent 21 years with a carrier, and this is not that there's anything wrong, but they won't tell you. Yeah. A doctor could tell you who they went to medical school with, or who they know from a medical society. So the answer is this: nobody's going to tell you. So for the first time ever, at least in my 25 years in the business, we're partnering with two companies. One is the predominant company that aggregates CMS medical data, patient safety, readmittance, infection rates, and we're going to rank and stack every specialist in a metropolitan area by body part, by specialty, and also rank the facilities. So if you have a cardiothoracic surgeon for heart vascular surgery, knee surgery, hip surgery, gastrosurgery, neurology surgery, everything. And we're going to have you call into a concierge number, and they're going to walk you through the process. So we believe you can find the price of everything, but we're going to bring true transparency, which is give me the quality rating. Because I can tell you in Southern California, there's a difference between the #1 rated orthopedic surgeon that ranks 99.7 in quality and the 120th that ranks 7% in quality. This is true information. And how can we not have consumers and members knowing this? I mean, you and I can play fantasy football. We can know everything about the quarterback we're going to start, how they do in domes, how they don't do in domes, third down conversion. But when someone is operating and cutting into your body, you have no idea what CMS quality data is. To me, that's not right.
Well,
so we're going to change that.
Said earlier, which is the people who are in the status quo are holding on to dear life. They've never wanted us to have that information, and the hospitals and insurers included.
You're exactly right, but why? And I can tell you, let me give you a true example real quick. I talked to a lady today, and I asked my friends at this company, I can't name the company because people read your podcast and we want a head start on what we're trying to do. She said to me, can you tell me in Philadelphia, I want to know if my doctor's ranked high in quality. She called me, I told her your doctor's ranked 98.7, the 8th highest doctor, an orthopedic surgeon for your procedure out of 130 in Philadelphia. She said, oh, thank you so much. That's peace of mind. It's emotional.
Sure.
Why shouldn't we have people have that information? So we're going to continue to break the status quo, but in a good way. These are things. So, and you know this as a doctor. What does high quality do? What does it lead to?
So I think what you're doing is fantastic. You know, a lot of the efforts I've been spearheading and championing, as well as others, is hospital pricing transparency and the quality transparency and access, which you've really emphasized is important as well. And I really think by the end of 2018, you're going to see really different, much more accessible. Your ability to access both these things is going to be improved drastically over prior 12 months. So I'm really excited about that. So let's move on to the last couple of questions. So Amazon, everybody wants to talk about what Amazon's going to do. Because of all the companies that have come out and said, we reached our tipping point, we're going to blow it up. Amazon's the one that everybody's kind of going, wow, they really have an opportunity to change things, because once they do it for their employees, it's so easy for them to take it to the mass market. So if you're able to describe to the Health Wealth Nation what you see Amazon doing, what do you think they're going to do? Give us kind of the 2 or 3 things you think they'll be doing.
Well, I think first of all, they put a stake in the ground. They said the current system isn't working. So that's the most powerful thing of anything. Yeah. But I think they're going to be creating their own TPA is exactly what they're going to be doing. And they're going to be bringing transparency, as we talked about today, better customer service experience, which of course Amazon is a genius, and better tools for people to make decisions, which Amazon does very well. So, I mean, everything that we should have been doing 20 years ago.
Well, and it's an easy math question, math equation, and let me describe it for the folks that are listening. So millennial culture, which I've been writing about for 4 or 5 years, is so in tune with the health system of the future. I know Dave Chase writes a lot about millennial culture and how it's so perfect for the health system of the future. So you start with millennial employees, and if you go to any of these big 5 tech companies across the world, they're almost all millennials. Okay, they're smart. They get to pay them less, and they give them a free lunch, and everybody's happy. So you got millennial culture, and now you have millennials who engage in the process. Look, they've had to walk and ride their bike to work. It's just part of their culture. They don't drive as much, or they Uber, don't even own a car. So you have this healthy lifestyle where it's not just so much going to the gym, but you're living healthy in all that you do. You're seeing a deterioration of market share for sodas, for unhealthy foods, for unnatural foods. So you see millennial culture combined with the fact that their lifestyle is different than the Gen Xers, and now Amazon has said, hey, that's a large portion of our employee base. They're hungry to live healthier. So what's the role of the employer? And it gets back to, so we have the EHCs, we have the engaged healthcare consumer, who in this case is the Amazon employee, and they're kind of going, we're onto something here. We have a head start. Our employees, unlike most of mid-market and Fortune 500 companies, our millennials who are ready for this, let's equip them and surround them with the resources to become engaged healthcare consumers, to live healthier, to have access to physician quality scores, prices for physicians in different hospitals and surgery centers and procedures. Allow them to shop and teach them that it's okay to shop for healthcare just like you do for a car or for a house, instead of your doctor or your hospital making you feel guilty for asking for a second opinion, which is how it's always been. So this Amazon approach, and Jeff said it right on, is they're so well situated to become their own TPA. But he also said something, what I heard is this: they're going to surround their employees with the resources and tools to make the right decisions. And whether they do it voluntarily or not off the bat, they're going to hit them hard when they don't. And that's really where the whole delivery system's gone. Is it's not just cost shifting to go to a high deductible plan. It's cost shifting if you don't engage. And
Correct.
They're trying to get you to engage. So give me one more thing that you see Amazon doing as they evolve towards this new model.
I think you're going to start seeing them use their locations. So they just bought Whole Foods. So I think you're going to start seeing them penetrate more of the provider space, but from a direct to primary care model. The direct to primary care model is very broken, as you know, and we need to take advantage of that model. And I think you're going to see them push that more through some of the retail locations.
And we've talked a lot about direct primary care on this show. To me, it's one of the 9 steps. I haven't really mentioned it on yet, but here's the book, Health Wealth: Is Healthcare Bankrupting Your Business? 9 Steps to Financial Recovery. One of those steps is called direct primary care. And you know, if you listen to the show, this is one of those that I say, hey, if you're an employer, do it tomorrow. Save a bunch of money. Happy employees, direct access, 24/7. Put a clinic on site. Contract with the clinic in your parking lot. If you've got 400 employees in one location or 500 in the same town, you're ripe to either put an on-site clinic or contract with a provider that's already got those resources. Those are the things Jeff's talking about. And what I loved, and he said it and we heard it before, Amazon bought Whole Foods. They already allow you to return things at Kohl's. So, who do you think's next, right? So if you see a Minute Clinic or this nurse practitioner clinic pop up at Whole Foods in the back corner, or even a side entrance, which would make more sense on the surface, at Kohl's and all these other locations, you know now they're going to war with UPS and FedEx. So, where do you think the next acquisition area might be, right? So all these things that Amazon's grown so big that it's encouraging for us in the community to see that they may actually use their platform to drive healthcare affordability in this country. So, Jeff, I always close the interview with this one question. I'm afraid to answer it because you told me you're from Houston. I'm afraid to get your answer because I'm a huge Dodger fan. Tell me your number one sports team that you root for, whether college or pro.
No question about it. Philadelphia Eagles. I grew up in
Philadelphia. You didn't say the Astros because I literally was about to pull the Dodger sign off the wall and hold it up.
No, I have a lot of my wife's from LA, but yeah, I grew up in the Philadelphia area. As you know, we never won a Super Bowl, so this was a big year. No question about it.
Too. On a closing note, I was actually speaking at an event just a couple days ago. Yeah, we're now March 2018 when this was recorded. And I walked in and my buddy who played college football, one of the owners of this home care company, said, hey, Nick Foles is staying at this hotel. And I stopped him and I said, I looked at my buddy with 3 minutes left in the Super Bowl and I said, can you imagine how different this guy's life will be?
Yeah.
Whether they win or lose. It's the one guy on the field. He either goes back to being a backup next year or fighting for a job, or he's got a ring and a broadcasting job for the rest of his life. And I was so happy for him. Not that I'm a huge fan of his or anything, but you always root for kind of the underdog. And what a great story. And now he's a Super Bowl champ for life. And here's the best part. He earned it. He played awesome. He led that team. So, Jeff, this has been really great. And I'm looking forward to getting to know Jeff. I think we're going to cross paths a few times here in the next few months. Jeff Bernhard with Continental Benefits, the president. If you want to learn more, you can come to health-wealth.com. You can just look at Jeff's all over LinkedIn like I am. He's always commenting, doing things, doing a great job of putting that message out there. We'd love for you to join our club of those people that want to share with the world there are solutions to reduce healthcare costs for companies and for individuals in America. So, Jeff, thanks for joining the Health Wealth podcast and radio show, and we'll catch up with you soon.
Josh, thanks so much. Take care. Bye-bye.
And I'll look forward to meeting you probably at the World Congress on Employer Benefits in D.C.
For sure. Thank you.